Welcome to Looking Back on Mac, where you'll hear from real people who are ready to share what they wish they had known sooner on their Mac journey. So watch as they share their journals and reveal what they've learned as they look back, to help give you inspiration as you look forward.
What is ARIKAYCE? ARIKAYCE is used in combination with multi-drug therapy for adults who still test positive for MAC lung disease after at least 6 months on multi-drug treatment alone. ARIKAYCE was approved by FDA using the limited population pathway. This means FDA has approved this drug for a limited and specific patient population, and studies on the drug may have only answered focused questions about its safety and effectiveness. ARIKAYCE was studied in adult patients. It is not known if ARIKAYCE is safe and effective in children younger than 18 years of age. ARIKAYCE is associated with the risk of increased respiratory adverse reactions, including allergic inflammation of lungs, coughing up blood, severe breathing problems, and worsening of COPD. While using ARIKAYCE, these side effects may become serious enough that treatment in a hospital is needed.
Hi, I'm Julie. I'd like to share what I wish I had known sooner on my Mac journey. So I'm going to read from a journal that looks back on my time with MAC lung disease. The first time I tested positive for MAC was many years ago. Back then, most doctors didn't have as many resources about MAC lung disease available to share. So my doctor started me on a multi-drug treatment, but neither of us really knew what to expect. It was a really long journey, and sometimes I felt like I was traveling on my own. It wasn't until 3 years later that I finally tested MAC negative. Unfortunately, that didn't last long. 1.5 years after getting MAC negative, I tested positive for MAC again. But by this time, doctors knew more about MAC. I started seeing a new infectious disease doctor who was more familiar with treating it. At my first visit, she asked me how I spent my days, then coordinated my appointments and my monthly sputum checks so that I could keep doing the things I loved. That's when I realized how much of a difference a strong doctor-patient partnership could make. I've always been the kind of person who tries to give it her all. Whether it's cooking my favorite dish, cheering on my alma mater, or mastering Mahjong. So I was excited to see that my new doctor approached my treatment the same way. She helped me understand what to expect with multi-drug treatment and why I needed ongoing monitoring while I was on treatment. It was a relief to have a doctor who saw me as a whole person. She wanted me to test MAC negative as much as I did. That's when I knew my experience would be much different this time. When I continued to test positive for MAC, after more than 6 months of multi-drug treatment alone, my doctor could tell I was discouraged. Although I understood the plan was for me to add ARIKAYCE to my multi-drug treatment, I had a lot of questions about this treatment and any potential side effects that I may experience. She patiently answered all my questions, and when I left her office, I said to myself, I can do this. When I got my first MAC negative test, I think my doctor was as happy as I was. After all, we did it together. Even now, my doctor remains highly engaged in caring and supportive as I continue the plan we have made together, staying on ARIKAYCE with multi-drug treatment for 1 more year after my first MAC negative result, and continuing monitoring and sputum checks. She also shares any new information she has learned about MAC and makes sure to keep me up to date. Looking back now, I realize it has made all the difference in the world to have a doctor who supports me every step of the way. MAC lung disease can be challenging, but I learned that having a great partnership with my doctor can help me face the challenge.
This was Julie's experience. See what other people with MAC wish they had known sooner on their journey, so that their insights may help you on yours.
Important safety information and boxed warning. ARIKAYCE can cause serious side effects, including allergic inflammation of the lungs. These respiratory problems may be symptoms of allergic inflammation of the lungs and often come with fever, wheezing, coughing, shortness of breath, and fast breathing. Coughing up of blood, hemoptysis. Coughing up blood is a serious and common side effect of ARIKAYCE. Severe breathing problems. Severe breathing problems can be symptoms of bronchospasm. Bronchospasm is a serious and common side effect of ARIKAYCE. Bronchospasm symptoms include shortness of breath, difficult or labored breathing, wheezing, and coughing or chest tightness. Worsening of chronic obstructive pulmonary disease, COPD. This is a serious and common side effect of ARIKAYCE. Serious allergic reactions. Serious allergic reactions that may lead to death have happened to people who take ARIKAYCE. Stop taking ARIKAYCE right away and get emergency medical help if you have any of the following symptoms of a serious allergic reaction: hives, itching, redness or blushing of the skin, flushing, swollen lips, tongue or throat, trouble breathing or wheezing, shortness of breath, noisy, high-pitched breathing, stridor, cough, nausea, vomiting, diarrhea, feel cramps in your stomach area, fast heart rate, feeling lightheaded, feeling faint, loss of control of the bowels or bladder, incontinence, and dizziness. While using ARIKAYCE, these side effects may become serious enough that treatment in a hospital is needed. Call your healthcare provider or get medical help right away if you have any of these serious side effects while taking ARIKAYCE. Your healthcare provider may ask you to stop using ARIKAYCE for a short period of time or completely stop using ARIKAYCE. Do not use ARIKAYCE if you are allergic to any aminoglycoside or any of the ingredients in ARIKAYCE. Before using ARIKAYCE, tell your healthcare provider about all medical conditions, including if you have asthma, COPD, shortness of breath or wheezing, bronchospasm, have been told you have poor lung function, have hearing problems such as ringing in your ears or hearing loss, have dizziness or a sense of the room spinning, have kidney problems, have neuromuscular disease such as myasthenia gravis, are pregnant or plan to become pregnant. It is not known if ARIKAYCE can harm your unborn baby. ARIKAYCE is in a class of medicines that may be connected with complete deafness in babies at birth. The deafness affects both ears and cannot be changed. Are breastfeeding or plan to breastfeed. It is not known if the medicine in ARIKAYCE passes into your breast milk and if it can harm your baby. Talk to your healthcare provider about the best way to feed your baby during treatment with ARIKAYCE. Tell your healthcare provider about all the medicines you take, including prescription medicines and over-the-counter medicines, vitamins, and herbal supplements. ARIKAYCE may cause serious side effects, including hearing loss or ringing in the ears, ototoxicity. Ototoxicity is a serious and common side effect of ARIKAYCE. Tell your healthcare provider right away if you have hearing loss or you hear noises in your ears, such as ringing or hissing. Tell your healthcare provider if you start having problems with balance or dizziness, vertigo, worsening kidney problems, nephrotoxicity. ARIKAYCE is in a class of medicines which may cause worsening kidney problems. Your healthcare provider may do a blood test to check how well your kidneys are working during your treatment with ARIKAYCE. Worsening muscle weakness, neuromuscular blockade. ARIKAYCE is in a class of medicines which can cause muscle weakness to get worse in people who already have problems with muscle weakness, myasthenia gravis. The most common side effects of ARIKAYCE include changes in voice and hoarseness, dysphonia, cough during or after a dose of ARIKAYCE, especially in the first month after starting treatment, muscle pain, sore throat, tiredness, fatigue, diarrhea, nausea, headache, fever, decreased weight, vomiting, rash, increased sputum, or chest discomfort. These are not all of the possible side effects of ARIKAYCE. Call your doctor or pharmacist for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or www.fda.gov ARIKAYCE.org/medwatch. What is ARIKAYCE? ARIKAYCE is used in combination with multi-drug therapy for adults who still test positive for MAC lung disease after at least 6 months on multi-drug treatment alone. ARIKAYCE was approved by FDA using the limited population pathway. This means FDA has approved this drug for a limited and specific patient population, and studies on the drug may have only answered focused questions about its safety and effectiveness. ARIKAYCE was studied in adult patients. It is not known if ARIKAYCE is safe and effective in children younger than 18 years of age. Please see full prescribing information, including boxed warning, at arikayce.com.